Hey, how are you? Good. Well, I'm sorry to see you under these circumstances, but I heard that you had a little bit of a toothache. Okay. Well, what I'm going to do today is I am going to take a look inside your mouth. We are going to use our little handy tools. And I actually got the plastic tools out. I had my assistant get the plastic ones because I didn't want to, touch anything inside your cheeks if there's an abscess or anything like that. And let me just look at these notes here. Okay, and today's Friday. You said that this pain started on Monday. Okay. Okay, so you haven't been able to wear your Invisalign at all. Right. Let me just see here. Okay. Well, unfortunately, the Invisalign, the optimal wear for it, as you can tell, I have mine in. The optimal wear for it is 22 hours a day, which means from meeting with us that you have 2 hours a day to keep it out. You can do those 2 hours consecutively. You can do them 10 minutes here, 15 minutes here. And it's going to set you back just a little bit because you haven't been able to, keep them locked in with the pain in your jaw. So why don't you go ahead and relax, and I promise this won't hurt at all. And I'm going to put on my gloves. Yes, I know, toothaches are not fun. Neither is coming to the dentist, but we'll make it as easy for you as possible. Okay, you might hear me throughout looking inside your mouth, speaking to my assistant. So you don't need to worry about that. I don't want you to talk at all or anything like that, okay? I just want you to relax. And like I said, I'm going to be saying some things to my assistant for her to write down. And we're going to take a look inside that mouth of yours and figure out what's going on. Okay. Do you feel like you need a bite wing to keep your mouth open, or are you okay? Okay. Well, your last checkup was fine, so I'm only going to work on the side of the mouth where the pain is, okay? Okay. All right. So why don't you open real wide for me? Okay. Does that hurt when I do that? Okay. How about that? Does that hurt? No? Okay. Sorry, I'm just trying to get in here. Okay. How have you been doing with the Invisalign? Do you feel like it's comfortable for you? Usually, after the first 2 days of having your new trays in, you're not going to feel much pressure. It's just the first 2 days of putting that new tray in. And this started before your Invisalign, correct? Oh, I'm sorry, after? Okay. Why don't you write down number 18? Okay, look up for me. Okay. 18, we're going to do upper right, number 6. Okay. All right. Now I'm just going to actually put a little bit of warm water. You still feeling okay? Okay. You're doing very, very well. You're very brave. Okay. Okay, open for me again. Just gonna look around the area here. Okay. And have you had trouble eating? Because I'm not seeing an abscess, but I'm wondering, when you eat, okay, so when you're eating harder food, apples, crackers, cookies, you're feeling that pressure. Okay, open up for me again. Okay, how about this? Does this hurt? No? Okay. Yeah, 18 and 6. And is that what I said? 18 and 6? Okay, hold on a minute here. Okay. Let's get an x-ray on those two. I'm not seeing an abscess. And we'll get a panoramic on it and see what we can see. Okay. What we're going to do now, I'm not seeing any abscess in your tooth. So what I'm going to do is I want you, can you just wheel that in here? Thank you. What I'm going to do is I want you to open your mouth as wide as you can without straining. And what we're going to do is we're going to put the panoramic x-ray. You're going to bite with your top teeth so that the roof of your mouth is gently resting on it. And the panoramic x-ray is going to go all the way around your head. And it's going to take 2 seconds. We're going to look and we're going to see. Because what I think is happening here is that there's an underlying cavity in between your teeth that I can't see with this mirror. The x-ray will show it. And then what we're going to do is I'm going to give you some antibiotics to make the swelling go down, make the pain go away a little bit. And in 3 days, when the antibiotics have kind of done their job, we're going to come back and we're going to fill that for you. Okay. All right. Perfect. And your mouth isn't too sore to do that today? Okay. All right. So let me get a fresh set of gloves on here. Thank you. And I just need you to relax. Take a big deep breath in and out if you feel. Okay, that's okay. You can be a little nervous. Yeah, just leave it right there. And just big deep breath in. Big deep breath out. 2 seconds. That's it. And then we're going to be done. Okay, so open your mouth really wide. Open, 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 open. And I want you to bite down on this piece right here, like this. Very good. Your head comfortable? Perfect. Okay, now I'm going to lean over here for 1 minute to flip the switch. The x-ray is going to go all the way around your head, taking a nice picture of that tooth for me to see, and you'll be done in 2 seconds, okay? Okay, so sit tight. Let me flip the switch. Perfect. See, that wasn't too long at all. Now open your mouth slowly. Very good. Okay, perfect. Now if you can take that x-ray and read it for me. I just want to get one more look inside her mouth here and see what we can see. Okay, now I want you to relax again for me. Open as wide as you can without straining yourself. If you feel the need for that bite wing, would you like that? Okay. Right here. Let me just get the bite wing. And this is going to take some of the pressure off your jaw. Okay. Alright. Now, I need you. This is just going to go on the side of your mouth. It's going to alleviate some of the pressure off your jaw, okay? Yeah, do you want to take a minute? You want to rinse your mouth out with some water? Okay, I'll get you some water. We'll rinse your mouth out. Give you a little break. There you go. Yep, and you can just spit right in that sink. Okay. Yeah, I'm trying to think. We're going to do, the panoramic should be back in about like 3 minutes. I'm just going to take one more look inside her mouth and just double check to make sure there's no, right. Okay, and just let me know the result. Thank you. Okay, you ready? And I want you to open as wide as you can without straining, and I'm going to slide this right in on the side of your mouth. You can just rest your jaw nicely on it. Nope, I promise you will not gag. You won't choke, anything like that. It's just going to rest comfortably. Okay. Are you comfortable? Okay. Good. Perfect. Now, I'm just going to look one more time on this side while we're waiting for the x-ray. I just want to make sure I haven't missed anything, okay? Okay. Okay. Let me ask, when I do this, do you feel anything? Any pressure on that tooth? It's more on your gums. Okay. Alright, well here, open up. Let's slide this out. Very good. Okay, now what I'm actually going to do is I'm going to put some of this. It's a little bit, it's ORMD. It's by the mouth doctor. And what it's going to do is it's just going to numb the pain a little bit until you can get to the pharmacy and get the antibiotics, okay? Okay. Good job. You're doing awesome. And open up for me. How's that feeling? It numbs right on contact. Okay. Need a little bit more? Okay. And open. Good job. Awesome. Okay. So that should numb it. On the way out, I am going to have our receptionist write you a script for an antibiotic. It's like amoxicillin. It's just a very common antibiotic. A lot of children get it when they get chicken pox. Sometimes if you have bronchitis, if you have the flu that's kind of lingered for months. And what that's going to do is that's going to take all the infection out. And then what we're going to do is in 3 to 5 days, I'm going to see you back here in the office. I'm going to numb you up. We're going to use the pediatric needle because I know you don't like needles. And we're going to go ahead and fill that cavity if that's what it is, which, thank you. Let me just see here. Let me just read this and see if it is. Okay. So it was between 6 and 18. Okay. And it was 18. Okay. Alright, honey. What you have is a little tiny cavity. It's starting. It hasn't gone too far. I know it can feel like an abscess because your gum's a little bit swollen. That's only due to the infection. But those antibiotics are going to get rid of it. And what we're going to do is we're, like I said, in 3 to 5 days, I'm going to check in on you, see how you're feeling. The swelling has gone down and you're feeling better. You're going to come back in. We're going to numb you up on this side of your mouth. Pediatric needle. We're also going to give you our topical, which is numbing cream before we numb you. So you're not even going to feel the needle going in. And then it's going to take me 3 to 5 minutes. I'm going to fill that cavity, get the bad decay out, and you'll be good to go. Okay? That sound good? Okay. And today, because you were such a good sport, you get our very brand new pink toothbrush. If you want to go ahead and give her one of the wrapped ones, that's just a little sample one. you are going to get our Crest Anti-Cavity Toothpaste. It's the new advanced formula. You can see Susie at the front desk on the way out. She's going to write you a script for the amoxicillin. You can pick it up at your local pharmacy. And you'll be all set. Okay, great. Well, listen, honey, you take care of that tooth, and I will call you in 3 to 5 days. My cell phone number is going to be on your paperwork. You have any trouble, you call me day or night, and I'll come back in and take care of it, okay? You're welcome. Take care of that tooth. Okay, bye-bye.